session. This is the last session for the autumn 2025 exam. And thank you to all who were with us in this preparation. And I hope all of you will pass. This is just a small session for the important things that you should do in these last few days and to pass your exam and to avoid blunders or mistakes. Many of you would be going to exam after the mock, or some of you will be appearing for the second time in the exam. So those who are appearing for the first time and not did the mock or doesn't know about the exam structure well, remember the first paper is always the essay paper, and second paper is the MCQ and EMQ. You cannot change the um, paper, like you cannot offer or you cannot ask for MCQ paper first and essay paper second. No, they are inbuilt. You have to attend essay first and then MCQ. So make your mind that you will be going for essay first and then EMQ or MCQ. On the exam day, you would have received an email, all of you who are appearing in the exam. They usually ask the candidates to join few minutes before the actual exam. I was asked to join 20 minutes before. Some of my colleagues were asked to join 10 minutes before, some 15 minutes before. So you will have this email with you. We have a different system, OpenReach, in 2023. Now this time there is a different system, Talweeb, and you all have received the instruction about that, how to join and how to click the answer and where to write the essay. Remember, no books and pens are allowed during the exam, and you have to keep the camera open all the time during the exam. They will ask you that move around your camera to your right and left and on the table as well, where your keyboard is there. And sometimes they may ask you to uh, show us the front of your laptop or computer, so you have to bring a mirror then to show the front of your laptop and computer. Okay. Please do not stick any notes by the side of your camera. Okay. They can catch it. And they would request you, no one should enter your room. It should be an isolated room. And if you are appearing on the exam on your MacBook or laptops or computers, make sure they are fully functional. Okay. Check them today if you have not checked them before, and um, and make sure they are working fully so that you do not have any problem during the exam. Do not forget your ID or passport. Last time, two of the candidates had booked an exam and then they booked a hotel room to appear in the exam, and they forgot their IDs and they were very much in trouble. So if you are going to hotel, if you are going to some other place to appear in the part one exam, some people prefer their hospital lab as well. So please do not forget your um, passport, or do not forget the ID that you have used to register yourself for the exam. Please allow everyone who are in the lobby. This is the session for all. All right. So these are these things will be checked, or these things will be done with you on the day of exam. So please make sure your laptops and cameras are working, your microphones are working. One of the candidate mentioned that his microphone is not working, and can he use the earphones or headphones, etc. So I assume they would say no, because they will think that you can be in contact with someone through these earphone as well. This is AI. This is AI time, and anything can happen. So they may not let headphones to you. to make sure your um, computer is fully functional. First paper is essay. I assume everyone would have enough typing practice because you were doing the weekly essay attempts, and majority of you were sending me as well. Make sure that you have attempted your essay in 40 minutes and then 5 minutes for review. Some of the candidates they spend an hour or more than that on the first two essays, and then for the last two essays they have 30 minutes each or less than that. Then they are in a rush, and then they do not write the things that they need you to write in your essay, or they make blunders, etc. So please, time management is essential. If you are attempting the weekly essays, I'm sure by now you would have this skill to arrange your essay in 40 minutes or 45 minutes. So this should not be problem for you, um, especially if you have done enough practice. Some of the people in the mock exam, they write their answers in paragraph forms, not with headings or not with bullet points. They will not deduct any marks from you, but it is better to write your answer with headings and with bullet points, because the examiner, it will be easy for the examiner to check your essays, and and the examiner will not miss any point that you have written. In paragraph form, if I'm distracted here and there, I may lose important point that you have mentioned, and you may lose a mark in the exam as well by this. You may have written, you may have typed it, but because it is a paragraph form, a lot of information in a single paragraph, so there is a chance that the examiner may lose that, may not see that important point and give you a negative mark. So better to write your answer in essay, in bullet points, and better to give some headings if it is a management question. In the rest of the questions, headings may not be required, but if it is management question, better to uh, write your answer with heading. Read the questions carefully, deal the patient in your question. For example, Nate baby who had intracranial bleed, and you are asked to how would you immediately treat this baby. So this baby has intracranial bleed. You need to give this patient platelets, IVIG, stuff, etc., to make the platelet count above 100. Do not say if the baby has bleeding, I will give platelet to make it above 100. If the baby has no bleeding, then I will only give platelet if it is below 25. Okay, so this is a poor judgment. They have given you a patient who is bleeding, and the platelet count is 4. This is a NATE baby. You need to give this patient platelet to make it above 100. Above 100. So if you are writing general things, so they will say this doctor has poor judgment. Uh, his judgment should improve till next exam, and they will make you fail. Answer should be qualitative. Um, there may be a 6-mark question, but you can write your answer in 4 lines. Okay? But it doesn't mean that for 6-mark question you have to write 6 lines or 10 lines or that. The hemostasis questions, they do not have much content to write. They are to the point questions. Yes, in transfusion you have a lot of stories, but not in hemostasis, not in oncology or general hematology. Write the qualitative essay, not quantity. Quantity doesn't matter in FRCPath. If you write more, there is more chance of mistakes. Be a safe doctor, enroll a senior for opinion. Remember, you are a registrar. You may be professor in your daily life. You may be head of department in your daily life. You may be consultant in your daily life. But if you are appearing in FRCPath Part 1 exam, you are a registrar. If you are dealing with any malignancy, any bleeding disease, any clotting condition, or um, things like that, you have to mention that I will inform my senior consultant or consultant on call for second opinion or consultant in hemostasis department in tertiary center for a second opinion. Then you are a safe doctor. If you have missed anything, for sure your consultant will tell you that do this thing as well. You do not take any decisions independently while you are a registrar. Even if when you become consultant, you refer the things to MDT, and MDT decide for everyone. Okay, or you ask your senior consultant for second opinion. So yes, you may be different in your real life. Your status may be different in your life, but for part one exam, you are registered. Okay, so to always write that I will take second opinion from my consultant on call. You are a safe doctor. If you are missing anything important, they will tell you. For example, if you are dealing with high risk APML, you have done everything but not mentioned dexamethasone for differentiation syndrome, and you mentioned that I will take second opinion from my consultant. Your consultant will tell you give him dexamethasone as well for DS prophylaxis. This is the mnemonic you all know. Please write it 10 times on the paper today so that you should not forget these important things. We do all these things in our practical life. We need to do we need to do this in our exam as well. Okay. So part one exam is just one more day extension of our real life practice. Okay. We we do breaking bad news to our patient. We will do that in the exam as well. We take our patient to MDT in our real life. We will do that in exam as well. We give them cards and trials, offer them trials. We will do that in the exam as well. We preserve their fertility and do pregnancy tests for young females. We will do that in exam as well. We give them CNS contacts. We will do that in exam as well. Okay. Use this mnemonic, or if you have made your own mnemonics, practice them multiple times on the paper. You still have 3-4 days, and so that these important things should not be missed. These things carry marks in management questions. And this is the structure of approach or the um, management essay. This is only for approach. How will you approach and how will you manage the patient? Use this mnemonic or uh, modify this mnemonic into your own preferred one, so that you should not you should not miss anything important. If you again, immediate action is important. If your patient is bleeding, you need to stop the bleeding first. If a patient has hyperviscosity symptoms, you need to deal that. If a patient blood film shows bilobe cells or hypergranular cells and suspicion of APML, you need to uh, offer ETRA to the patient after negative pregnancy test if the patient is a female. After that, you can do clinical assessment, you can do investigations, and breaking bad news. Remember, breaking bad news does not offer to oncology things. When I was checking mock for the people, they mentioned breaking bad news only in the oncology. No, hemochromatosis is a breaking bad news as well. This patient will have venesection all his life. Okay, this is a breaking bad. Any diagnosis in hematology, because we are hematologists, is a breaking bad news. If they give you a patient that this patient has idiopathic hyperinsulinemia diagnosis, this is a breaking bad news. When you are telling the patient, you will break that news in a breaking bad news way. Okay? Hemochromatosis is a breaking bad news. Type 3 1 Willebrand disease. The question was a bleeding disorder. In the mock exam, it's a breaking bad news. You will tell the parent in a breaking bad news way as well. Okay? NATE diagnosis is a breaking bad news. So you have to apply BBN in all the fields of hematology, not in oncology only. You have to tell them the diagnosis. Leaflets are for everything in hematology. And prophylaxis. Remember, if you're dealing with a bleeding disorder, okay, hemophilia, type 3 1 Willebrand disease, you need to think about prophylaxis as well. And do not miss follow up in approach question or in the management question. You had a file related to emergencies. I had shared with you during the sessions. It is still present in the on the website. Do not miss them. Okay, you know what are the emergencies? The important were the APML, TTP, hyperviscosity syndrome, the tumor lysis, neutropenic sepsis as well, and many others that is mentioned in that PDF or in the session. Okay. Your first line should be, when you recognize it, that this question is about APML, this question is about TTP, this question is about um, hyperviscosity. Your first line should be, this is a hematological emergency which need urgent intervention in the form of, depending upon the diagnosis. After that, whatever you want to write, you can write. Okay, but tell the examiner that you have recognized that this is a hematological emergency and that need urgent intervention. Okay, if you are dealing with TTP, the guideline says the first thing should be discussion with TTP consultant. If you say that I will arrange blood tests for the patient, I will do CT scan, I will send ADAM-TS13 for the patient, and then I will talk to a TTP consultant, this is a bad judgment. You have seen the blood film, in NHS, we do a routine blood test, which include full blood count, LFT, RFTs, um, and when the BMS thinks that this is hemolysis, they add hemolytic screen as well. You have all the result in front of you. You have seen the blood film. You have gone through patient notes. So call the TTP consultant first, and then do everything whatever you want. But give the examiner an impression that you have uh, diagnose this as hematological emergency, and you know that we need to do immediate actions in this patient in the form of ETRA or plasma exchange or discussion with TTP consultant or involving ICU for PLS or respiratory cases, etc. This is a UK exam. Do not write things related to Australia, New Zealand, and Sudan. Okay, so you have to write only UK exam, UK recommendation. There are a few things which are not present in BSH guideline. Okay, there are ELN recommendation about that, and I have informed you what are they. You need to write those things. Do not use non-standard abbreviation. I have given an example of TCP. Somebody write TCP in the mock exam. I messaged her, what is TCP? She said, this is thrombocytopenia. This is not a recommended abbreviation. And some people have made abbreviation of triangle. I asked her, what is this? This triangle is for diagnosis. We may be using them in practical life, but they are not for exam related thing. You can use only standard abbreviation like for hematological malignancies or chemotherapy, the CLL, MCL, ABVD, CHOP, polar CHOP, these are the standard abbreviations. Do not make abbreviation for yourself. Examiner may not recognize it, and in your mind you may have mentioned something very important, and examiner would say, what is TCP? And they would have uh, cross it, and you may lose marks. Spelling mistakes, uh, if you make mistake in medical words, that is okay. But if you make a mistake in the common English word, then this is not forgiven. You may lose marks. For example, rapid. I was taking a mock exam. Somebody has mentioned the spelling of rapid as rabbit, RABID. Actually, the spelling was RAPID. This is a rabbit. Please do not make these common English language mistakes. This is annoying for the examiner. Do not write extra details. Will come under irrelevant detail. In part one exam, when you receive a feedback from the BSS, they do not explain to you why you failed the exam. They will only say irrelevant details, insufficient details, or extra details. That is, they do not give you comments that we give you when we are checking your mock paper. Their feedback is very limited. You do not know which part of the question you have failed. Where have you done suicide in the FRCPath exam? Do not assume that examiner is reading my mind. Okay. If I'm checking your hemostasis paper, I am CAR-T consultant. I do not know about hemostasis much, so I have a key in front of me. Whether the candidate has mentioned prophylaxis, no, -2 mark. Candidate has mentioned family screening, no, -1 mark. Okay. So you have to mention these things in your approach or management essay. Okay, breaking bad news, consent, fertility preservation, HIMSS, etc. Pregnancy test, whenever you start your essay, check whether your patient is a male, female. If female, what is the age? If it is a young female, either this is a question related to pregnancy or they want you to mention fertility preservation or pregnancy test in your essay. Fertility preservation, this is a must thing in the oncology. If you are giving chemotherapy in the oncology question, you need to think about fertility preservation. Some of them are emergencies, like Burkitt lymphoma. You do not have much time to send the patient to fertility clinic. But in other, yes, you need to mention that I will offer fertility preservation. Trials, just name them. No need to write details about the trial. Okay, but you have to mention trial in every treatment section or in the management section. Trials can be first line, they can be second line, they can be third line, they can be last line. Okay. Trials are present everywhere in UK. If you know them, this is better. I have sent you a PDF which contain the trials from the last few years, not the recent one, but the last few years. So important things, do not forget, please, is headings, consenting for venesection, consenting for transfusion, consenting for chemotherapy. Do not forget MDTs. Do not forget leaflets, cards. If you are dealing with a pregnancy question, newborn is a part of that answer. Please do not forget newborn and follow up. Breaking bad news, it is important in all the 4 sections of hematology. Okay. Uh, Address patient wishes and beliefs, pre-chemotherapy testing, and address urgent needs. This is very, very important. So if you are dealing with general hematology question, yes, everything is important, but mention if there is any urgent needs or not. Maybe it is a eosinophilia question and the patient is coming with shortness of breath and edema. Maybe eosinophil has infiltrated pericardium or the pleura or the lung of the patient. They do not forget breaking bad news. Even hemochromatosis is a breaking bad news. Okay. Idiopathic hepatoeosinophilia is a breaking bad news. You have to apply all these things in exam as well. We do practice these things in real life, but you have to type it down during the exam day as well. Hemostasis, hemostasis patient will always bleed, or sometimes they have clots as well. Okay, patient, if someone has a clot, they are in pain. Okay, if someone has a bleeding disorder, they will be bleeding. So your first thing in the management or approach would be immediate management, okay, which is the urgent need. Address the bleeding, address the pain because of the clot. If it is a bleeding question, do not forget prophylaxis. Prophylaxis is important in bleeding disorder. Okay. If you are dealing with congenital hemophilia, severe congenital hemophilia A or type 3 von Willebrand disease, and they ask you for management and you do not mention prophylaxis, okay, it means you are harming your patient. This patient will come again next day with the bleeding because you have not given this patient prophylaxis. So you have harmed your patient. Okay, so they will harm you in the marking as well, and you may need sometime. They may ask you to come back in the exam. School planning, because hemostasis bleeding disorders are always, majority of them are always children or kids. Few of them will be acquired bleeding disorder. They are elderly. but the majority of the bleeding disorder in exam are the hemophilias or von Willebrand's, which are kids. They need a school plan as well. Oncology, do not forget fertility and pregnancy, and transfusion. Please do not forget short. Okay. When you open transfusion question, think whether this patient need short referral or not. Okay. Um, People forget it. There was a mock exam for part two people last Sunday with you guys as well. Okay. And there were three short related questions. People forget short. When you forget to write short, they will shoot you and you have to come back in the exam. These are considered as blunders or suicide in the FRCPath exam. Please do not forget prophylaxis and screening in hemostasis. Do not forget short in transfusion and the common things, breaking bad news, fertility, pregnancy testing, follow-ups. We do these things in our practical life. Transcribe them during your exam day as well. Try to write these things on a paper multiple times so that you should not forget. Please do not write it on your table. Write it on the paper and discard the paper. MCQs, everyone has received their feedback from a mock exam where they should emphasize more for the MCQ. But the hot favorite topics for the MCQs are the inherited bone marrow failure syndrome. Okay, they can ask you about the diagnosis by giving you a clinical feature. They can ask you about mutation. Autoimmune hemolytic anemia, there is a table in the guideline which has a lot of MCQ potential. Red cell membranopathy and enzymopathies. There was a EMQ in the mock exam. Okay, so there are many EMQs about it in the other sites as well. They will give you some HPLC interpretation values, iron overload values, MCQ, flow markers, translocation, mutations. All these PDFs are with you as which have been forwarded to you as part of part one exam. MCQs in hemostasis, inherited platelet disorders. Again, they can ask you about mutations, or they can ask you about the diagnosis by giving you some feature. Live transmission aggregometry, whether there is abnormality in the LTA. This is clopidogrel related. This is aspirin related. This is Bernard-Soulier syndrome. This is platelet storage disease. Types of von Willebrand disease, emicizumab effect, pregnancy effect on clotting factors, and inheritance. Autosomal recessive, autosomal dominant, or X-linked recessive. Transfusion, do not forget entity doses. They can ask you what is the entity dose in the cesarean section or cell salvage, or patient has a potential sensitizing event, or patient has FMH, or patient has a D positive platelet unit transfusions or red cell transfusion. What dose should we do? 12 lives, specifications of intrauterine transfusions, red cell antibodies, their quantification and titration are important, papain enzyme effects, and donor selection criteria. So what to do in these few days? Write the emergencies on paper multiple times with a statement, just like I mentioned to you. Okay. If you have made your own mnemonics, write them on a paper multiple times with explanation. What does the individual word mean? Okay. Fertility, MDT card, pregnancy test on a paper, please. Okay. Create scenario, like for example, I'm going through DLBCL. What scenario can they give me? Miscellaneous PDFs. Those who has the miscellaneous PDFs, please cram them, and you can use them in between the two papers as well. They are not much. They are a few papers. And if you have appeared in the mock exam, I have written your mistakes on the mock paper as well. Say short for the few days in transfusion. Okay. And prophylactic screening, counseling for bleeding, which means prophylaxis, you have to do family screening, genetic counseling, and bleeding disorder. Okay. And say consent, fertility, and pregnancy count for malignancy. This is for oncology and general hematology. Okay? Consenting, fertility preservation, pregnancies, and different cards for malignancy. Okay, make your own statements, not necessary to say what I have written, but the main idea is that you should not forget these important things. Okay, you will lose marks. You may fail your essay, you may fail your exam if you forget short and transfusion question, and it was important over there. Okay, you may lose mark and essay and paper if you forget prophylaxis in your bleeding disorder patient where it was required. Okay, and you have given hydroxycarbamide to a young female who is pregnant. You are a registrar. Remember this. Okay, I repeat. You may be professor, consultant, head of department in your actual life, but if you are appear in real in the part one exam, you are the registrar. So in such cases, you have to take opinion from your senior to save yourself. You still have some time to act on these advices and come the MCQ PDF that I have given to you. And if you have any question, you can ask me. Yeah, you have a lot of time to ask your questions now. You can type it in the message box. You can shout out. I deliberately keep the session small so that if you have any question, then I can answer it. What is the MCQ PDF? As those people who have attended the course of our course, we have sent them miscellaneous PDF which contain translocations, mutations, which contain mechanism of actions, different stains, and trials, etc. Go on, if there is any question. What your advice regarding camera? Is it better to use a laptop camera or you prepare external camera? Um, if your laptop camera is working, um, yes, that is fine. No need for external camera. But on safe side, I had bought um, external camera as well, that in case something happened to my camera during the exam, I should have the um, another camera with me as well. It is not costly. I think external camera just costs 15 to 20 pounds. Better to keep it with you. But if you order it now, your exam is on Tuesday, the order may not come. But if you can go to market and buy the other, it's fine. I have shared the link in the WhatsApp group. If you can please forward those to your colleagues who are ST3, ST4, or specialty doctors, they can join us our October sessions for spring 2026 exam. I assume you guys have no questions, then you can open your books again and start preparing. If you have any question, please shout out.